I'm pretty sure you have had a friend or a mom or an aunt or somebody that you know that has like a little medicine bag.
Correct.
And what I mean by this is that they have every single type of medicine. Like you need charcoal pill, they got. Paracetamol, they got. Antacid, they have. Any sort of painkiller, they have. Everything they have. Yes, some in our producers also saying you eat Charlie Limau, you know. Any minyak angin, everything they have in their bag.
Yeah.
But as much as we appreciate this kind of friends or family members, it is also very, very dangerous because sometimes, you know, when you get a stomach ache, it could actually indicate more than a stomach flu.
Correct.
You might actually be I'm not sure what you know you can be, but it can be more serious than that.
Yeah.
So those are some of the examples of you know, the dangers of self-medication.
That's right. So self-medication is our topic today. You know, of course, there are myths about it and there's advantage about it. There's disadvantage about it also as well. But of course, more often than not, when it comes to self-medication, it's actually not that good. It's not recommended because there's no proper diagnosis. Definitely there's a delay in seeking proper medical attention and dangerous drug interaction and more. Exactly. So all of this is actually very important. So we need to know actually, should we actually continue self-medicating ourselves, our kids, our family members, our friends, and a whole lot more of wonderful people around us. So to actually get us to actually understand self-medication. So we brought in an expert, as I would say. She is a pharmacist from Hospital Shah Alam. Please welcome Janet Woon Xiao Mei. Hello, Janet.
Hi, morning.
Hello, morning.
Self-medication. Right. Yay.
Yeah. Yes. You first, let's begin with the definition of self-medication. I know it's pretty explanatory right there, but from a medical terms, what is the definition of self-medication?
Okay, self-medication is actually defined as consumers. Okay, they will look for their own medication after they self-diagnose a symptom or a disease. Okay, without consulting a doctor. Right. And also, if let's say the consumer keep on using the same medication prescribed by the doctor previously without having proper supervision, then that is what we call self-medication. So it is actually one of the public health issues that we are concerned about, because self-medicating without proper supervision can actually lead to causing harm to the consumers.
Right. Yeah. So this is basically a societal phenomenon, right? People self-diagnose themselves, take medicine that they think that I can take this medication because it's this particular problem that I'm facing. So I'm just going to take that particular medication. So why do you think this is happening? Is it because they don't want to go to the hospital? They want to save their money? What do you think is happening?
Actually, there are a few reasons behind this. One of it would be the increased cost of living. So many of us would like to save money. So save money in terms of like healthcare. So they will tend to go for alternative medicines or just get the medicines from the pharmacy. Okay? And also some of them would like to save the cost in consultation from private healthcare institution. So they end up getting the medicines directly from the pharmacy without a proper supervision, proper monitoring of their disease progression. And also some individuals, especially those who use the internet very frequently, they tend to, they believe that they have enough information about their disease, and then they feel assured to use the obtained information and self-treat.
Because very often, I mean, especially if you have had the same kind of symptom, like for example, a fever, right? You already recognize that, I'm going to get hot, I'm going to get sweaty. Usually for me, it's like dry throat and all that. And I'm just like, okay, it's the same type of symptom. Therefore, I should be using the same type of medicine. But what are the consequences of actually doing that? Because we know that different types of medicine, they either counter-react each other or they make each other worse, right?
Yes.
So how can we, I don't want to say stop people, because at the end of the day, you can't really stop people, but at what point do you say, you know what, I'm not getting better, I should definitely go and see the doctor now?
So it's very common for us to reuse our medicines at home for symptoms that are mild. So if let's say your symptoms does not improve within a week or so, or it gets worse, then you need to see a doctor immediately to have further examination so that the main cause of the symptoms can be identified. Because some of the symptoms may indicate a more serious problem behind. For example, severe abdominal pain in women at reproductive age might actually be a sign of ectopic pregnancy. Or if let's say your fever is prolonged for more than maybe 3 days or 5 days, then it might indicate that there's a dengue fever, for example. So we will always advise patients, if let's say your symptoms does not improve, then you have to seek medical treatment.
Okay.
Right, and then when it comes to self-medicating and stuff like that, somehow they find themselves taking antibiotics.
Oh, yeah.
And once you
that's
take
very common.
antibiotics, right, and you don't even finish the plan, right, the duration course, maybe you could actually tell us, what is the severity if you don't even finish the antibiotic plans, and why you should actually not simply take antibiotics.
Okay. So the public should know that actually not all infections require antibiotic treatment. So antibiotic resistance may emerge when we self-treat ourselves with antibiotics without following the correct dosing, the administration timing and the duration, or if we use an antibiotic to treat something that does not require antibiotics, for example, viral fever. Okay, a viral infection, sorry. So if antibiotic resistance occur, it happens when the antibiotics used to treat an infection will lose its ability to treat, to kill and fight the bacteria. So then we will have the term superbug. Okay, superbug where the bacteria is already mutated. Okay, their structures have been changed and they have become resistant to the antibiotic. So if that happens, then it will cause major consequences to the healthcare system. Because when there's a superbug, then for example, a minor illness that can be easily treated will become fatal because of the superbug.
Because it does not work anymore.
Yes.
Oh my.
Yeah, that's actually insane to think about it. But we're talking about the harmful side of self-medication. What about things that are like cuts and wounds, where I think I don't really necessarily need to go to the doctor if I don't think it's as deep enough. And again, one of the top 2 factors about self-medication is that you want to save on time and also save on money, right?
Yes.
So at what point can I self-medicate? What are the things that is like, okay, it's fine to do at home. It's fine if I just put an iodine, I put on plaster on it, for example, like open wounds, right? So what are the examples of diseases or conditions that are okay to kind of just do it at home?
Yeah.
Okay, a popular example would be self-treating mild cases of COVID-19. As we all know, actually we are not free from COVID-19 yet. Okay, so if for those who are infected with mild cases of COVID-19, they are required to quarantine at home and they can self-treat. Okay, because the treatment does not require any antibiotics. Okay, so there are several medicines that we recommend for them to keep at home. For example, paracetamol in case there's any fever or body aches, cough and flu medicines, sore throat medicines, or any gargles, rehydration salt, and also self-test kits. But they need to continue monitor their symptoms. Okay, if let's say it gets worse, then they must seek medical treatment immediately.
All right.
Okay, so you're a pharmacist. I'm sure you've met a lot of people coming to you to purchase medicine and all that, saying that, you know what, this doctor actually asked me to get this particular medicine from the pharmacist, so that's why I'm here to actually see you. And more often than not, maybe you would also not recommend that type of particular medication, so on and so forth. Yes, because you're a pharmacist, you know how medicine works. And doctors as well, they know how it works as well. But of course, coming down to the root of the problem, maybe you would also know, right? So what are the kind of typical common cases where people will just come and meet you to just get medicine? For what disease and what type of medication?
Okay, common cases would be some of them, they skip their appointments in the hospitals or clinics. They will just bring their old medication, like for example, hypertension medicine, diabetes medicines, and they just get it from the pharmacy. So some of them, they already, their last appointment with the doctor was maybe last year.
Oh my.
So it's very dangerous because they don't have a proper monitoring of their condition. So if they keep on taking the same medication without proper regular health checkups, then they might even put their health at greater risk because they might cause uncontrolled, they may cause their disease to be uncontrolled and maybe lead to complications.
Interesting.
Yeah.
So actually, I'm going to pull a little bit of stats here. So this was a study that was done by Internal Medicine. It says here, of course, self-medication is widely prevalent among the Malaysian population, and the study shows that supplements and vitamins are most commonly consumed, followed by flu and cough remedies and sore throat products. So in terms of mixing supplements and mixing, because whenever we say, take vitamin C, drink lots of fluids, and then of course you also have your medication on top of that. So what about mixing these two supplements and medication? Is it something that we should be wary about? Is it something that is actually recommended to strengthen your immune system? Any advice for our audiences at home?
Okay, so if you want to take supplements, yes, you can do so. But first, you need to check if the products that you bought, is it registered under the Ministry of Health? Okay, and always consult your doctor or your pharmacist first before taking any
Pharma
supplements.
check.
Yes, pharma
You
check.
always come on the show, pharma check.
Yes. Okay, then after that, because if you have any chronic diseases, for example, diabetes or any heart problems, before you want to take any supplements, do consult with your doctor or pharmacist first, because we are afraid of the potential interaction with the existing drug that's been prescribed by the doctor. So if there's any drug-drug interaction, so the intended use of the prescribed medication may be altered already due to the interactions.
Okay, counter interactions where your drug will go against each other and then make things worse for you, your own self as an individual.
They're having a fight right inside your body. We don't want that,
Yeah, we don't even know what's happening inside our body because of all this kind of stuff that we're taking. But of course, supplements, they are okay, and vitamins, they are okay. So for vitamins and supplements, you can take as compared to drugs out there, right? Okay.
But you still need to consult a doctor or pharmacist first before you start taking it.
Yeah, because again, they could counteract each other.
Yeah, so we need to check first, is this supplement suitable for you?
Yeah. What are some of the examples of medicine or types of medicine out there that do counteract each other or just make they make your body worse? Because like blood thinning medicine, you're not supposed to take different types of blood thinning medicine, right? So can you tell our audiences what are some of these medicines that you should definitely not mix together?
I think the most common medicines that are being mixed are painkillers. Okay, because painkillers, we have a lot of different types of painkillers that falls under the same category. For example, NSAIDs. Okay, for example, your mefenamic acid, and then your Celebrex and all. So some of them they don't know. They will go to pharmacy A maybe to get this type of painkillers. Then after that, when it's not working, they will go to pharmacy B to get another type of painkillers. But actually, both of the medications falls under the same category of painkillers.
Right.
So if you do so, if you take, we call this polypharmacy. That means you are taking medicines, different types of medicines from the same category, and then that will lead to increased chances of you having adverse effects like gastric.
Yeah.
And there's also cases where they take their own type of medication because someone told them to do so, like Mr. Google, and then allergic happens, right? Allergy and all this kind of stuff. You know, it basically fights inside your own body because it's not suitable for you, right? So in terms of all this thing that our audience who are watching at home, you don't want them to actually go through it because we don't want them to actually suffer. Where do you think that they can actually seek for advice without actually going to see the doctor, if there's such thing?
Oh, okay. They can always see a pharmacist, or if there's any inquiries regarding medicine, they can contact our National Pharmacy Call Center. Okay, the number is 1-800 886722, if I'm not mistaken. Okay, so then they can call from Mondays to Fridays from 8 a.m. to 5 p.m. except for public holidays.
Okay. All right.
I remember the number 1-800-886772.
I think 6722.
Okay, 6722. Okay, if anything, please do go ahead and double check the number over at Google, yeah? So again, what are the dangers of over-medicating? I know this is like a very obvious question, but we still need to alert our audiences. What are the dangers of over-medicating and self-medicating at home?
Okay. There are actually a few issues, like what we discussed earlier. First is the antibiotic resistance, okay, and it might also cause adverse effects or worsening your diseases, Yeah. So if let's say, just a reminder, if let's say their symptoms persist or their disease persists, do seek medical treatment so that they can be treated accordingly as soon as possible.
Yeah.
Is there such thing where if you take a medication that's supposed to work for you given the time frame, and if it does not work, then you're in trouble? Is there such thing?
Yeah, I guess so. For example, gastric medicine. If let's say you have severe gastric pain and then the doctor has given you a gastric medicine, but within that week you don't see any symptoms improving, and or you have a more serious symptoms, yeah, then you have to seek medical treatment.
You should go to a doctor.
Yes.
Don't
Just
sit at
simply
home.
a conclusion here, just to head to a doctor if it's possible.
yes.
There are also, of course, Klinik Kesihatan, which is a cheaper option as well, right?
yeah.
Your local clinics,
Correct.
which is again a cheaper option as compared to going to a private hospital and whatnot. I'm actually very, very curious. We're talking about these are over the counter. These are medicine. What about alternative medicine? What are the dangers of mixing alternative medicine or traditional medicine with the current
Modern medicine?
Yeah, modern medicine that you're taking as well.
The risk is that they might have drug-drug interactions, because if, for example, in alternative medicines, a lot of herbs are used. So for herbs, they are lacking information of any interactions with a certain drugs. So we won't know for sure. So especially if you are taking any blood thinning medicines,
Yep.
we won't recommend our patients to take any traditional medicines.
Oh.
Is there any type of food that diminishes or sort of makes the medicine not as reactive or as functional? I heard that, if I take a certain type of pill, I can't drink coconut water.
And that's one, you cannot take something that's actually, contains a lot of herbs.
Yeah, as well.
Yes.
So what are some of the examples of like food or traditional medicine that you can't mix? Definitely cannot. It will not make the medicine that you're taking as functional or as effective.
An example would be milk. Okay.
Milk?
Yeah, milk.
Oh.
Actually, there are a lot of drug-drug interactions with milk. Yeah.
Oh,
So
why milk though?
Because of the molecule
Okay.
structures and all.
Yeah.
So some medicines, if you take with milk, it might affect the absorption in the stomach. So we must always make sure, like let's say before you want to mix a medicine with milk, check first if there's any interaction.
Okay, and how do you check? Yeah.
You can call the national
number that you
pharmacy call center.
Or just go and see a pharmacy or a doctor.
yes.
Don't simply do it at home.
What are some of the other type of liquids? Obviously, alcohol you can't take. Obviously,
yes, alcohol.
So other than milk and alcohol, what are some of the other types of liquid that we should definitely not mix with our medication?
Coffee. Sometimes
Okay.
Coffee, yeah.
Okay.
So normally, so we will always recommend swallowing your medicines with plain water.
That's the best.
Yeah, that's the best.
So not even electrolytes, not even.
Yes.
All right. So plain water is the way to
Yeah.
go. Not even tea, right?
Tea, if you can avoid it, then it's best to avoid it. Just take plain water.
Right. Okay, so there you go. Water is the best when it comes to all your medication, and do not self-diagnose yourself at home, okay? If it's like a couple of weeks probably or days where you're supposed to get better, and if you don't get better, this is where you're supposed to go and see a doctor.
Yes.
And if there's one thing that you'd like to tell all the people out there who are watching at home, do not simply go to the pharmacies. Besides actually self-diagnosing yourself in the wrong manner, what else would you say to them?
I will remind them to be a smart consumer, okay? Then, and also always check first with your doctors or pharmacists before getting any products. Avoid getting products from unauthorized or illegal sources, and don't be too easily being misled by advertisements claiming that they can treat various of diseases. And also, do not stop taking prescribed medications by the doctor if the doctor never advised you to do so.
Yeah. If the doctor says finish it, just finish it.
Yes.
Yeah.
Yeah, there you go. So thank you so much again, Janet, for coming on the show.
Thank
you so
you.
much. I will definitely not take milk anymore with any of my medication right after this.
And coffee, yeah?
And coffee as well, and tea, just plain water. So again, those are the advice from Janet. Ladies and gentlemen, if you are again self-medicating, we are all guilty of it.
Correct.
Please do stop if your symptoms are, not
Worsening.
getting worsening. Just go ahead, just spend that little bit of money to get better in the future, all right?
Exactly. Thank you once again, Janet, for being here.